To order, go to 5-in-1fryer.com.
So that chokehold may have been the chief cause of Eric Garner's death, but what about the medics seen on this video seemingly not helping Garner after he becomes unresponsive? Richmond University Medical Center tells CNN that 4 emergency responders were suspended without pay immediately after Garner's death. 2 paramedics were cleared for full duty soon after and continue to work with patients. 2 emergency medical technicians remain on, quote, non-direct patient care assignment. So let's take a closer look now at Garner lying motionless on a Staten Island sidewalk, and this was back in July 17th to be specific. Afterward, we will have a medical expert who's going to tell us what they saw and what they believe would have been an appropriate medical response. We edited the video to give you the best possible view of Garner's chest, and I want you to look carefully at whether or not you see him breathing. And again, I have to warn you that this video is very disturbing because essentially what you're seeing is the last moments of a man's life.
That's crazy. You can't breathe.
Stretcher, all right?
Try to get him up on the stretcher. It'll take like 6 minutes.
So let's have an honest discussion. Everyone's being so careful about this, right? Let's have an honest discussion about this. And emergency physician Sampson Davis is here. So I took the stairs today, right? Right. So he was just in this major altercation with police.
Right.
And as you're looking at him on the ground there, this is me. I don't see anything. Right. Is he breathing?
He's not. There's no chest wall movement. You don't see his abdomen moving. I don't know if he had a pulse. The EMT felt for a pulse, but if he did, was it a shallow pulse? Was it a bounding pulse? Was his airway at all secured? Did she take her ear and listen to any breath sounds? Was it a stethoscope placed on his chest to see if his lungs were exchanging or if he was breathing at all? You know, at this point, from what I see with the video, I don't see any signs of him breathing at all.
Okay, because he said, I can't breathe, I can't breathe. So no one, it appears, is trying to help him breathe, but they're checking his pulse. Just because you have a pulse doesn't mean you're breathing.
That's correct. That's correct. Because your pulse will, usually if you stop breathing, then your pulse will continue until a few minutes, and then eventually it will stop. It will slow down and stop completely.
So what should have been, so you're saying there should he have been given chest compressions? Because you hear someone there, I don't know if it's the guy who's taking the video or someone says, no one gave him CPR, why aren't you giving him CPR? And the person on the scene says, he's still breathing.
Right. I mean, it's unfathomable how things unfolded here. There should have been some leadership, some ownership. Someone should have stepped up and said, what's going on? Why is he breathing? What happened? And after assessing what happened, then the EMT on scene should have assessed his airway.
So is this a matter of semantics? Because they're saying he died in transit. Is that correct?
Right.
All right.
Correct.
So then would this be in transit? Because if he's not breathing there on the sidewalk, he technically may still have a pulse.
Right.
Or we don't know because we're not there.
Right.
But are we looking at someone who is transitioned or is...
I think he's transitioned. I mean, there's a difference between the time that we pronounce someone dead versus the actual time of death. So someone can be without a pulse, someone can be not breathing, and we can be going through the process of medical intervention, chest compression.
I'm asking you, was this man dead on the sidewalk?
I mean, from what I see, all signs from the visual would say yes, but without being there on the scene to listen and to assess him directly, it's hard to say. But I mean, I think from what I'm seeing, the man breathing. I don't know if the pulse was ever confirmed, but CPR should have been started. He should have been intubated.
And they can't pronounce him.
They can't pronounce him there because no intervention has been done to try to save him. You see, it's scoop and go. Someone should have did chest compression. Someone should have listened to his lungs.
Thank you, Sampson Davis.
Thank you.
Appreciate it. Prosecutors work with police all the time. Some people question whether they can be impartial when a cop is suspected of a crime, excuse me. A New York State lawmaker wants to change that and set up a special office to investigate police cases. She joins me next.